My name's Jo Nolan. I'm the Executive Director here at BMI The Chaucer Hospital in Canterbury. We offer a range of cancer services from diagnosis to treatment. One of the things that we're very conscious of is that the care and the treatment and the diagnosis is only part of the journey of patients living with cancer. And something we developed 6 years ago was setting up a support group called Chaucer Chatters.
I set up Chaucer Chatters in 2012 because I saw there was a need for a support group. We actually give the chemotherapy here, but there was more needed than just that. We need to support people during the treatment and afterwards as well. And the Chaucer Chatters, which we named it, quite aptly really, because we do chat a lot, is part of that. Some patients can feel quite isolated after their treatment finishes, thinking, what now, what's next, where's it going to come back, etc. And this is just like a stepping stone to help them regain their confidence and self-esteem they might have lost. People can feel quite isolated during the treatment.
I had my treatment here in 2012, and when my treatment was coming to its end, Sue had been discussing the thought of having some form of support group. Came up with a wonderful idea of Chaucer Chatters, and we ran through a couple of ideas, and I thought it was fantastic. And then it started in January 2013.
We meet here at the Chaucer Hospital every second Wednesday of the month in an evening, and very informal. We have homemade cakes and tea, courtesy of the Chaucer. A variety of subjects for all cancers, not just one particular mode of cancer. We have expert advice from our consultants, so a whole host of different things to suit different needs for different people at different times.
I started coming because a friend recommended it to me, and it's somewhere that you can talk about cancer because everybody has experienced the same near enough as you have, and it's very safe, it's very informal, very friendly. The talks they give and are really informative, but in a sort of really simple way so you can understand it. So it gives a bit of background to what's happening and what they're doing to you as well. So then that makes people that are going through treatment, I think, more relaxed because you've got a little bit of background.
It enables people to share experiences together, and by doing that they gain mutual strength from each other as well as expert advice from people.
I've seen people that have come in who are in a very fragile state because they've either been just diagnosed or they've had their first chemo or their first chemo's coming up, and that's quite frightening. And so you can talk to somebody with a bit of knowledge. I mean, okay, not medical knowledge, but you know, sort of the feelings and the fears. You can sort of say, well, I've been there and this is what I did, or don't worry about that. I'm sure that's quite normal. And I know that would have been really helpful for me when I was going through treatment, because you know, there's so many things happening to you, you're not prepared for.
There's still things that I'm living with post, obviously my diagnosis. I have lymphedema that I have to live with daily. There are lots of other things, which is the emotional side of it, because once you've finished your active treatment, you do feel quite lonely. So being able to come to a group and have an array of ladies and gents there, it's nice to actually to have that interaction with them, to know that you're not alone. Yeah, it's fantastic.
To me, they're the most inspirational group that I've ever met, that they're fun, they're lively, that they raise money for charity, but most importantly, they give each other support. And that really is part of the ethos of what Chaucer Chatters is about.